Hello, I'm Kenneth Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physiotherapist. And we're talking about the rehab for acromiale. So this is someone who has a failure of the fusion of the shoulder, of the acromion, which is part of your shoulder blade, and they've got a weak spot in there, which is just a bit of cartilage, and it's cracked. And what's happening is every time they lift their shoulder up, it's catching because the acromion, the bone here, is being pulled down into your rotator cuff as you lift up. So it catches. It's impingement. And in this situation, what I'll be doing is a shoulder arthroscopy and then an open approach over the top of the shoulder and putting a small plate on to fix those two bones and get them to join up the way they should be in the first place. And it's quite a rewarding operation. It does do well. Sometimes it's combined with a rotator cuff repair. And we're just going to run through what you're in for after that surgery. So typically you'll be in hospital one night. The next morning you'll see the nurses. They'll change your dressings and you'll be getting out around about 10 a.m. But before that, you're going to see the physio. So, and you're going to get an x-ray. So take us through that visit with the physiotherapist.
So you'll be in the sling for 6 weeks, and so the physio will teach you how to put on and take off that sling independently. They'll talk to you about the best way to have a shower and the best way to get dressed. So all those really important activities of daily living. They'll also show you some gentle range of motion exercises just to make sure your shoulder doesn't stiffen up too much while you're in the sling. And some active range of motion for the adjacent joints, so making sure your hand and your elbow and your neck don't stiffen up. Physio is pretty low-key while we're waiting for the bone to heal in that first 6 weeks. You can go and see your physio at 2 weeks post-op. They can check that the wound looks okay and just review your exercises, but there's not a lot of input early on.
We've got to get those two bones to actually join up, and that involves taking it easy and not moving too much. So we see them back at 6 weeks. We'll get an x-ray. The x-ray, it's usually possible to work out if everything's healed up on the x-ray. Sometimes a little bit tricky because of all the metal there. But at 6 weeks, we're going to take them out of the sling. And what are we going to do then?
Going to get them moving.
Yeah.
They're usually a bit stiff from being still for 6 weeks, so we give you a stretching program to get your range of motion back. Encourage you to use your arm for all your light, normal day-to-day activities. We just don't do any heavy lifting while your range is returning. So moving it, but not loading it too much.
Yep. So then we see you back at 12 weeks post-op. What are we doing there?
So then we check that your range of motion is returned. So you video them and the patients and make sure that they're moving well. And if they are moving well, then we start some strengthening.
Yeah.
Get them ready for their sport or work or whatever they need their shoulder for.
Yeah, and that's typically, from my point of view, about where we need to be with in terms of post-op follow-up, because the shoulder's healed up and you're just going down that pathway of strengthening at that point.
Yep. Yeah, returning to all your, activities that you love.
Yeah. So there you have it. That's the rehab for acromiale surgery. Thank you for listening.